This is Dr. Vaishali and I'm reading from the book Substance of Homeopathy, book written by Dr. Rajan Sankaran, and chapter number 11, Physical Symptom of the Miasm. When we talk about the physical symptom of miasm, we do not mean the pathology. What is more important is the nature of the pathological processes. The pathogenesis. Thus, an indolent ulcer with a hypergranulation means proud flesh following an injury, etc., would represent the psychotic miasm, not a syphilitic like it represents with the ulcer. Whatever the pathology is, the case, its physical state will reflect the miasm. The acute miasm will show sudden violent reaction, exasperation, or unthreatening condition that cause panic in the mind of the patient and those around him. An acute miasm does not usually cause chronic structural pathology. However, the acute miasm can aggravate the structural pathology, especially when the tendency to such a pathology, which is in the genetic disposition, is quite strong in the patient. If it is quite strong in the patient, the psoric miasm in its physical aspect will show the same high and low as we see in the mind. It will demonstrate hypersensitivity to external factor and will manifest the same struggle and activity. In its pathology, psora will tend to cause functional disturbance at the level of various system and reversible pathological changes, although this is not invariable. In psychotic miasm, in its physical aspect also has a hyper reaction. In psora, the reaction are to a variety of stimuli since the struggle is with outside irritant, while here the weakness is perceived within the self. So psychosis is usually not much affected by the external factor, but yet it can be aggravated by the something very specific. Thus, it does not show a plethora of the modality as does in the psora. In psychosis, since one is trying to cope with the body's own specific weakness, its reaction will be concentrated at specific site and the organ system, tending to cause chronic slow trouble, usually with a tendency to overreaction in the particular sphere. Means this aspect is further amplified in the pathology with no stimulus. Pathology with I again repeat the note. This aspect is further amplified in pathology and miasm. The reaction will also be same no matter what the stimulus is or even with no stimulant. Thus, we see overgrowth, hyperimmune response, fixed and steady state like asthma and structural pathology. The disease usually has an insidious onset and the course is steady. In psychosis, we find a tendency to discharge that leave indelible stain, means fixity is there. The syphilitic miasm shows slow degenerative process with the occasional severe sudden destructive episodes like gangrene, myocardial infarction, ulcer. Such seemingly acute conditions are usually based upon the degenerative process that has been taking place over the long period of time. The acute miasm therefore usually shows acute sudden intense reaction to the stimuli. Psora shows the maximum generalities, the maximum craving and aversion, and there may be several and varied modalities in the same patient. Psychosis has a very special craving and they are usually limited in number. The modalities too are very specific and few in the number. Encephalitic too has few specific craving and its sensitivity to stimuli is much lesser than the psora. They seems not to react up to the certain degree of stimulations and then react abruptly in a destructive manner.